Drbeen.com. Welcome to one more show. This is one more exceptional lecture or exception lecture in the on the weekend. There is a good news overall from South Africa about everyone who is infected with Omicron, but there is also very important good news for children as well. So what I wanted to do was I'm going to discuss the children's case first and their outcomes first, the good outcomes, and then we would go over the report in a separate talk. So let's start our discussion. Welcome to everyone. This is Humanity's Coffee Shop, and we are bright and early, as John Snyder just said. So here, the report is this. This is the summary of the report. In the province from where this report is, Gauteng area, 1,511 COVID patients were in the hospital. 113 are under 9. So they say that this is a little unusual. But in the last 2 weeks, there have been 34 admissions in pediatric COVID wards. Last 2 weeks. So I think that it is safe to assume that November was the month with Omicron in South Africa. And it is interesting to see the stats for that. Anyways, they are being very careful, which I think is right. And they're saying last 2 weeks. So last 2 weeks, 34 admissions in children's COVID ward, 0 deaths. And the stay in the hospital is also 2 to 3 days or 1 to 2 days. Children have mild disease, and most of the admissions are possibly because of out of abundance of caution. This is what I was thinking yesterday, that there may be a community spread and there may be the parents being nervous that here we have Omicron and the child has these symptoms, let's quickly go to the hospital, and doctors also not exactly knowing what could be Omicron doing. The doctors may be saying, all right, let's have the child over here. So children have mild disease, admissions possibly out of abundance of caution. Majority of the patients, so this is children and not children, adults as well. Majority of the patient in COVID wards are not oxygen dependent. And remember, South Africa is only 25% vaccinated. So even when the discussion continues to be that vaccinated patients have milder symptoms, I don't think that these are all vaccinated patients. So there are just milder symptoms in general, which is a good news. And I hope that this news stays. And so I'm going to look at this report later on, but I want to show you some of the data, which is very interesting. So this is the South Africa's daily COVID-19 cases. So if you see, there is definitely a rise, but if you see, that rise is actually on the decline already. One. Then if you see here, this is the number of deaths. Number of deaths are actually reducing. I wish that this is all true. This is not a fairy tale. And this is, if this is all true, we are getting out of the pandemic, and by the help of a variant. So here, these are the number of deaths, and you see that with each wave, there are deaths. However, with this forming wave, we see it almost daily that in November, somewhere in the middle, there was an increase in the number of deaths, but then that reduced, increased again, and if you see, now it is reduced again. So is it because this is a weekend and the reporting is not there yet, or it is actually reducing? But if you compare this to the cases when they started, so here the cases started going up. Look at this, November 21, 22. And if you see here, of course, the deaths would follow a little later, but we are here and the deaths are actually reducing. So in my opinion, that is a very, very important sign. And this is what is coming out in the reports as well. So if it becomes a common flu-like thing, and only for 2 days, then that will be a beautiful outcome. Okay, I want to continue showing you this data. Then I want to stop and come back again for the bigger report. So then here is the Gauteng's, and once again, number of cases are a lot, right? So on the daily basis. A few days ago, we were seeing that these numbers were in hundreds and 11,625. So that is a sharp rise, agreed. But check this out, new deaths are 11. This is a sharp rise over here. But if I go down all the way to the data itself, look at this data. Admissions even to the hospital are more, but ICUs and people on ventilator, they stay actually lower than the other times before. Look at this. October is higher. November is higher. November 12 is higher. November 16 onwards are lower. So, yes, deaths would follow later on, but hospital admissions would follow immediately within 2 3 days of the problem. And the ICU and the ventilators would follow immediately as well. So, this data over here is actually indicative that we are, at least in South Africa, at least in Gauteng province, we are seeing very good results. And I'll keep saying that this is not. Um, so I see a lot of folks, even from South Africa, continuing to connect this milder disease in vaccinated. These are not all vaccinated people. And then I want to. So this is it for today. I'm going to go in a few minutes to the next part, and we'll look at the bigger report as well. And so here is a little tiny doodle I did. So Big Pharma is saying to little O, the Omicron, why are you doing this to me, bro? So on this one, I'm now going to see some comments. Lenny says, is it reducing because of people taking charge of their health? Vitamin exercises, eating healthy. So it may be, but we cannot just all of a sudden have it. This has something to do with the virus itself as well. Until the data coming out, and I'll actually, this report that I presented is based on a data report coming out of South Africa that is based on this report. This report is coming out of South African Medical Research Council and Dr. Fareed Abdullah, which is the director of Office of AIDS and TB Research. So I don't think that they can just start making up this data. I mean, that would be not the best thing to do. So I don't think it is just the people being careful, which is important. For example, I think hospitalizations are people being careful because there is such a noise about Omicron. And anybody who may have symptoms like flu, they must be thinking, all right, I need to go to hospital. I do not know what would happen. So that uncertainty is probably driving these cases. But it is interesting that the virus itself is really, really spreading faster, milder outcome, less stay in the hospitals, less oxygen needs, recovery quickly, more in the younger people. This is very interesting. So John Snyder says, I'm having fun. Just read the wastewater report with patient conditions report and gene changes South Africa. Very good. Thank you, John. And enlighten us as well. So uh, instead of making it bigger, this show, I'm gonna stop it and then we'll go over that report as well. I just want to see if there is any important question related to this. This Caesar says, do you believe that the virus is in auto extinction? So thank you for bringing it up, because here is what happened. I tweeted this morning about this report, and someone said, Moro Long said from South Africa, yep, I'm in South Africa and my doctor told me the same thing on Friday. She says that so far, out of the many COVID-19 patients that she has seen as a result of Omicron, the fourth wave, she has only had to admit one because a person had an underlying blood clotting disorders. Then he says, do you have any idea why this variant could be milder? And I said, clearly the mutations that allow it to transmit faster are also making it less pathogenic. Beautiful outcomes if these observations stay true. So again, this is really, really important, that we may be jumping the gun. I hope not. So far, all the data, so far the days past, believe it, if this Omicron was dangerous, more lethal, more bad, the whole world look at the reaction of closing down the borders, stopping the travel bans. Imagine if it was actually lethal as well. We would have all been sitting in a very different mindset over here. This news could not have been hidden or changed by numbers. So I think that there is a possibility that this virus would now, this variant is going to help. And this is what we've been talking about. As the virus replicates in us, it is going to try to, the selection pressure is going to bring on the virus that would help us and like to live with us, that would be less damaging to the host. This is a normal behavior. So, and Africa being only 25%, South Africa being 25% vaccinated, and actually having a lot of suppressed or immunocompromised patients, actually, it is not the vaccine causing selection pressure. The virus can actually mutate over there, and even then, you are seeing that mutations are actually, and this may not be Omicron, may not be from there, but mutations actually humanize the virus, should humanize the virus. And so eventually virus had to live with us, and that is what I had been saying for more than a year. And that one statement that I had been saying, that the virus would become more friendly to us and virus will be more transmissible, as it is more transmissible it would be less lethal, this one statement had brought a lot of wrath on me. But this is the normal science. So happy that this is happening. I'm going to go over the bigger paper in a second, so I'm going to stop here. Thank you very much for joining right in the morning, and I would see you in a few minutes. And yeah, so this is important that doctors are actually not using much of the medicines as well. All right, so please like, subscribe, and share. And if you would like to support this work, there are links in the description. You can buy me a coffee, or you can be a patron, or you can use PayPal. Thank you very much. I'll see you in a few minutes again.